You know, there's a new treatment offers adults in the USA life less defined by schizophrenia medication. Here today, I have with me Dr. Gustavo Alva, Medical Director at ATP Clinical Research and a clinical trial investigator, Patrick, who's also living with schizophrenia and was a participant in the clinical trial. Good morning, gentlemen. How are you?
Good morning,
How are
James.
you?
Happy to be here.
I'm glad you're here. I want to start with you, Patrick. Share, tell us more information about your personal journey with schizophrenia.
Well, it's had its ups and downs. It's almost like an emotional roller coaster. But with me, I've succeeded in getting my degree and maintaining a job with help from the treatment and a great support system.
Definitely. Now, what are the benefits of long acting injectables for you on this?
Well, LAIs for short make it easier to remember to take my medication so I don't miss a dose or overtake a dose. And it also really helps me to manage my symptoms. But also, it gives me more personal freedom. For example, I was able to take a trip for a couple months without having, only having to return to the doctor half yearly. So,
I hear you. Now, Dr. Alva, what is your experience working with this patient population?
Well, it's quite extensive, James. I've been working in this space for over 27 years. And schizophrenia is a really challenging illness. It's lifelong, chronic. It's characterized by distortions in perceptions, emotions, thinking. And we know that antipsychotic medications are an essential component in treating schizophrenia. However, remembering to take one's medicine is a critical portion of controlling symptoms and costly relapses. Part of the problem, though, is that most clinicians oftentimes offer their patients pills, where long-acting injectable medications have been shown to delay relapse for adults that live with schizophrenia in a better fashion than pills. Unfortunately, long-acting injectables are oftentimes underutilized.
So, Doctor, can you share more about the approval of Invega? Am I saying it right? Invega Hafvira? Havira?
Yeah, and Vega Hafiera. So yes, I'd be
Hafira.
happy. Yeah, Hafiera. I've partnered with Janssen to share the news about this new long-acting treatment option because I was one of the principal investigators involved in the clinical trials. Um, the important thing with this medicine is that it's truly transformational. It's the one medicine that offers the fewest doses per year for adults that live with schizophrenia in helping them have a life less defined by schizophrenia medicine, right? So to be able to hop on Invega Hafiera, one has to be on Invega Sustenna, which is a once a month long acting injectable for at least 4 months. And then patients have the option and the flexibility of going up to an every even 6 month formulation, which is Invega Hafiera. It's important to couch, though, that all medicines have pros and cons, so benefits and risks, and finding the right medicine and supportive treatments is truly the foundation for ongoing recovery for adults that have been diagnosed with schizophrenia. That's where, again, one should consult with one's doctor. There's a great website, indegahafiera.com, where folks can get a whole heck of a lot more information.
Now, Patrick, what else would you like to share with other adults living with schizophrenia about finding out about their treatment options?
Well, schizophrenia is a lifelong challenging condition. And a lot of times it's hard for patients to remember to keep track of taking their oral medication. But, it's important to just discuss with your doctor and people who love you about the best treatment options for the patient.
You know, Patrick, you were talking about a support group and support systems. Every morning here in St. Louis, there's a group of us that are up at 5:30 a.m. and we have coffee at the Starbucks in University City. And we actually have a guy who is suffering from schizophrenia who is taking pills. And we are his support group. We understand what's going on with him. We know that, he's always going to the doctor almost every week or every 2 weeks to take his pills. So I agree with you. When you have a support group, man, it is great. And this guy is really a good person. He's actually a poet. And that's what's interesting.
Oh,
He's
wow.
actually a poet, and he's actually written a couple of books on poetry, and I've actually featured him on my show. So, I mean, we love having him. We worry about him when we don't see him in the morning. We will text him, "Hey, where you at? How you doing? Get your butt down here. We need to drink coffee
Yeah.
together." And here's the fun part, Patrick. We've been doing this as a group for over 16 years.
It's really good. That's
Uh,
really something,
it-
you know.
It is. So, Dr. Alva, where can our viewers learn more about this treatment option? You mentioned the website.
I did. InvegaHapYear.com, obviously the National Institute of Mental Health, the National Association for Mental Illness are great resources as well. And I'm glad that you made mention of that personal story, James. You know, research has consistently found that 1 out of 2 individuals with oral medicines are non-adherent in their treatment regimen. And that's where long-acting injectables can have such an important leeway in helping them maintain their wellness. After all, it's human nature to sometimes forget to take one's medicine, but this illness in and of itself sometimes evokes problems with insight and judgment. And any opportunity that we have at enhancing the opportunity to stay on track with one's medicine really makes a big difference. Patrick and your friend are great evidence for that.
Not only that, but also having loved ones and having friends who are a support
Yeah.
group to help out with it too.
Absolutely.
Definitely.
Absolutely.
Definitely. Dr. Alva, Patrick, thank you so much for joining us on Morning Blend.
Thank you for having us, James.